how I started in the chronic pain world after, being totally thrown in and not knowing anything, but hearing person after person talk. They needed education. They need to know up front, you can talk to somebody in chronic pain about their condition if they're sitting in front of you. And even if they say, I don't believe that, or that's not true, or something like that, they don't want to hear again what they need to do to change. They just need to hear and be validated they're experiencing something, period. Yes, you are experiencing pain. Most of them are willing to hear. The science comes in the education, usually right up front, like this is a brain issue. This is, yes, you have these wounds, or yes, you have inflammation. And of course, you have inflammation based on your history of what you've done. And the reason you have inflammation is because of this. When you are really upset in the fight or flight, so let me talk to you a minute about your fight or flight. When you're upset, it depends on who you're talking to, anxiety, depression. When you're upset, the amygdala, a little part of your brain, flies off the handle and starts to signal other parts of the brain that you're in trouble. And so then it sends out hormones through your system, and trigger neurotransmitters then send out these hormones that cause inflammation in your body. And so over time, that inflammation is going to start breaking down your body. So you're going to be in pain. And it doesn't seem like maybe even doesn't seem like you've done anything, but in fact, you've lived chronically stressed. And it's the stress that needs to be worked with. And I'll have people say to me, I'm not stressed. I don't live a life of stress. And they've just told me 10 things, that are like, oh my God, stressful. So then I use the balled up hand situation here. It's like, if you do this, if you hold your fist, tight enough for long enough, you're going to forget that you've got a tightened fist. Your brain just makes it normal. And then so when you start to release that, it starts to hurt. You actually begin to realize how tight you've been held. So that might be the first thing that somebody's working with for quite a while is so go back out in your life, pay attention. Is this good stress or is this bad stress? Because both stresses can cause the same thing. Um, so the education pieces are all in there in the beginning. It's not about you're bad. It's not about you're lazy and those kinds of things. In the beginning, I think it really is about education because they need to know the situation they're in and how complicated it's become, and that they actually can do something to change it. And, many of them may be at a point where they feel like they can't change it. And so they won't. Okay, well, they're going to stay in the allopathic medicine line. But those who truly want to change it end up in the alternative world anyway. Sometimes I will use the crying baby scenario and to be able to say that when the brain is screaming and sending off all these hormones and causing inflammation, we actually need our own attention. We actually need to pay attention to what our body is doing. But instead, in our world, we've been taught to try to get away from it. And so sometimes I'll ask people, what do you do? What do you do to try to manage your pain? And they'll say, well, distract. So then I will talk to them about how distraction can work sometimes, but oftentimes it's not actually what's needed. And that distraction can be another form of stress. Um, but good or bad stress, depending on what you're doing. Often then I'll have them do something as simple as just rubbing their hands together just so they can feel their hands, and then putting their hands on their thighs just to feel the heat to make that connection. And many times people will say something like they feel a little better. Like they just that simple connection, they can feel a little better. And so that is If somebody's completely overwhelmed with the information, people too quickly will go into, oh, so ultimately, really, this is my fault. I created all of this. I did this. And they go down the shame spiral. And so going down the shame spiral that's a whole nother thing of being able to say that this is your responsibility. It's not your fault. So there's ways for you to learn to take responsibility for yourself. And there are things to learn here about how this isn't your fault. And the shame that was put on you was actually by probably a bunch of doctors, family, whatever happened in your history. And so that's a thing to work through too. So, there's all these ways that people are going to respond that I think for the most part, it's the educational piece itself that will finally get them to a place of, okay, give me something to do.